Jennifer, what is the test, and why shouldn't men get it?
Well, the test, it's a blood test. It's called a PSA test, and it's a blood test, and it tests for a protein that's made in the prostate gland naturally, and it's also made by prostate cancer cells. And it's not so much that the test doesn't work. I mean, it detects what it's supposed to, but there's just a lot of controversy over whether the test really benefits men.
And I think you mentioned in your story that I guess the big risk here, people are saying, effectively it's identifying some cancers that maybe aren't that harmful.
Exactly. It does. It has caused doctors to go in when the test is at a certain level, to go in to look for prostate cancer. So men are having biopsies where either they're maybe finding cancer or they're not finding cancer. But in cases where they're finding cancer, it's probably very early stage. But in a lot of men, it's felt that cancer that they'll never die of that cancer. It may not cause any problems, that they'll more likely to die of something else, like a heart attack or, some other health condition.
Something like radiation treatment, which can be pretty painful, is probably more harmful.
Right. I mean, men undergo, in most cases, you'll undergo surgery or radiation for prostate cancer. And the task force was saying that up to a third of men can be left with, urinary incontinence or impotence, that there's some pretty serious side effects.
Now, are there risks here that if we encourage men not to get this test, that maybe some prostate cancers could go undetected, some serious ones?
Yeah, I mean, that's the concern. That's the concern of a lot of urologists and oncologists, that it's not like there's a great substitute test. Men can go in for an annual rectal exam, but a lot of doctors say that you don't find cancer until it's big and it's harder to treat.
Yeah, this is great conversation to have in the morning over your coffee.
Yeah,
rectal exams. This is what we wake up to.
Everybody's had their coffee.
Now, insurance coverage. This is another issue, of course. Of course, a lot of men get tests like this, and right now they're covered by insurance, right? But is there a risk that with the federal advisory panel saying it's not effective, that things like Medicare or private insurance plans won't cover them?
There is a risk, although there's a current law on the books that actually predates the healthcare reform law that requires Medicare to pay for this test. Doctors tell me it's about $35. So, it's if men have to pay out of pocket for it, some people could probably swing it. It's not clear what private insurance companies will do. A lot of them will likely still keep paying for it in limited cases.
Great. Jennifer, thank you so much. Much more on the website and in Personal Journal today with Jennifer's story. Jennifer Corbett-Doran, thanks so much. And coming up, we have we're going to tell you a little bit about why the economy is in such deep trouble still.